population. I will now share the most current case counts. There are 71,157 confirmed cases of COVID-19 in Canada and 20,907 cases in Ontario. Chatham-Kent has 90 cases and Sarnia-Lambton has reported 204 cases. Michigan now has 48,021 cases, with 9,897 cases being in Detroit. Today, we are reporting 745 cases of COVID-19 in our community, an increase of 13 cases from yesterday. 39% of our cases have occurred in long-term care homes, including both residents and staff. 300 cases are resolved, 25 people are in hospital. 17% of our cases are between the ages of 20 and 29 years. 15% of our cases are between the ages of 50 and 59, and 20% of our cases are 80 years and older. 43% are male and 56% are female, and 1% is unknown at this time. Our community has lost a total of 62 people to COVID. 47 deaths have occurred among residents in long-term care and retirement homes. Our health unit is working with 17 long-term care and retirement homes that are currently experiencing a COVID-19 outbreak. Testing for COVID-19 is based on a clinical assessment. Common symptoms include fever, a new or worsening cough, and shortness of breath. However, other symptoms may be present, such as a sore throat, unexplained fatigue, an increase in falls, nausea, vomiting, chills, and headaches. If you are feeling unwell and need to seek a health assessment for COVID-19, there are several options. Complete the online self-assessment tool available at ontario.ca, contact Telehealth Ontario, or call your primary care provider for a phone or virtual assessment. To access a local healthcare provider, walk-in clinic, or virtual medical assessment, please visit ehealthwindsor-essex.ca. Windsor-Essex has 2 COVID-19 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. Please note that testing is available for people who have symptoms of COVID-19. Please continue to visit WECHU.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone, and thank you for joining us. I regret to report the death of a man in his 60s who passed away yesterday related to COVID-19. I'm sorry for his family and would like to express my condolences for their loss. As we prepare for additional announcements from the Premier's office related to the reopening of the province, I would like to remind all residents to continue to practice and follow public health guidance, in particular around our older adults and seniors. Older adults and people with chronic medical conditions are at a higher risk for more severe COVID-19 symptoms, including death, and we have seen that with the numbers in our community. Due to a weakened immune system, it is more challenging for older adults to fight off infectious diseases. Chronic diseases like diabetes, cancer, and heart diseases are also more common in this age group, making them more vulnerable to serious complications. In Windsor-Essex, we have a higher proportion of seniors and individuals living with chronic conditions compared to the rest of the province. We all are doing more to help keep our families and ourselves safe from contracting the COVID-19 virus. Public health guidance, such as hand hygiene, monitoring for any symptoms, practicing physical distancing, and limiting close contact with those outside your house are the most effective ways to prevent COVID-19. In Ontario, those over the age of 65 and individuals who are immunocompromised are advised to self-isolate. This means limiting interaction with others, including your family members who do not live with your house. Now is not the time to start visiting other people in person, especially your older parents or grandparents. Limited social gatherings to those in your own household minimizes the potential of community spread of COVID-19. This is especially important for those that are at the highest risk. Again, these are the seniors and people either who have a chronic medical conditions. To maintain your health and protect yourself, older adults and individuals with chronic medical conditions, you are advised to stay connected with your loved ones and friends over the phone or through virtual means. Work with your healthcare provider to ensure you have a supply of necessary medication. Use delivery services or curbside pickup options such as much as possible, or arrange for someone to run essential errands for you. Get adequate sleep, maintain a healthy diet, and stay active. Keep physical distancing from others at all times. I understand that staying isolated from friends and family is particularly challenging during such a distressing time. As excitement around the opening of businesses mounts, you may be thinking it is okay to get together. I would like to urge caution to all the residents, and in particular our seniors, to continue to limit social gatherings, essential trips to stores, and maintain physical distancing. These steps, combined with proper hand hygiene, are the most effective way to protect yourself and others during this pandemic. We're all in this together. We have to be working together to protect and limit the spread of COVID-19 in our community. Thank you.
We'll now take questions from the media.
We'll start with Windsor.
Just a question about yesterday's statement about Lakeside Produce and the cases there. There were a number of comments on social media questioning why that was released now sort of in the middle of May rather than in early April when the outbreak began there.
So the reason that we issued that media statement is obviously around the heightened awareness about the safety of these workplaces and the number of people who are contracting the disease in that population. We wanted to assure the community that we have been working with these farms for quite some time, and we have had cases in this population. And we have been working with all the farms that have cases, especially this one would have the highest number of cases, at least in our region, 13 cases. And we were able to track down all of these cases, and all of these cases are close contacts of each other. There is no risk of spread in the community or even at the farm. The farm is cooperating with us. So we have all that information, and we just wanted to provide more reassurance to the community that we are in close contact and working with these farms.
Any questions from the Windsor Star?
I'm okay for now, thank you.
Any
Questions from CBC?
Yes, we have been talking with a few people who are pushing to reopen churches.
Do you have any concerns about people returning to religious practice?
So I think we'll have to go back to what the Emergency Management and Civil Protection Act dictates. Right now, there is a limit on how these services are being operated. So we'll have to go with the provincial direction on that. At this point, I think the best option is to continue with your religious practices at your home or in a safe way without breaking the Emergency Management and Civil Protection Act guidance. If that changes, then there will be more flexibility in terms of where people can practice their faith. At this point, we are just following what the Emergency Management and Civil Protection Act is guiding us.
Is your concerns that's basically what you said earlier about seniors being very vulnerable still?
And that is why I'm saying that right now it is in place, and we will still make that recommendation, but recognizing that these places of worship is not only visited by seniors, but by everyone. So we'll have to really take a good look at it. But the bottom line still stays that as we are seeing more and more people outside in the community, that doesn't mean that the crisis is over and we have to let our guards down. It is even more important now when you are interacting outside with more people outside that you must follow some of those guidance, and especially those who are at a higher risk of developing and contracting some of these complications associated with COVID. So that's why we want to take it back to the basics of what is important that everyone need to be aware of. And it's not over. People still need to follow some of those guidance. So don't get distracted by the number of people that you see in the street or the number of cars that you see outside. The risk is still there, and we like to keep it contained the way we have been doing for the last 2 months. I think 2 months or longer. We still need to practice all the same practices that we are doing right now.
Okay, thank you.
Any questions from Blackburn?
Would you say the risk is greater now than maybe perhaps what it was in the beginning, or was the beginning of it higher because there were still not those travel bans and things like that?
So your question, I think I'm having a difficulty in hearing you. You're asking about the probable cases?
Just the level of risk right now. You're saying, people are going out, they're seeing more people out, they're thinking perhaps this is not as much of a risk as it once was, but we have more confirmed cases in the region, more current cases in the region now than what we had, say, even at the beginning of the pandemic.
So all I can say is there's if you're really looking at it from a risk perspective, the risk probably hasn't changed in the last, few weeks. It still exists. It has not gone down. The good news is it hasn't gone up, which is, I think, a good sign. The risk could have gone up, and instead of seeing 10 cases on an average, we could be seeing like 50 cases or 60 cases, 70 cases every day. So we are not there yet. So I cannot say that the risk has increased, but the risk hasn't gone down as well either. What we need to focus on is what are we doing to keep either the risk at the same level or even less than what we have right now. And all these measures and recommendations that we are putting forward is to either keep the risk at the same level or even reduce it. Some of these measures, if people are following actively, it should help to reduce the risk. Right now, I think the risk is still the same. It hasn't changed. The good news is it hasn't increased. So there's just difference. Reopening things doesn't mean that the risk has gone down. The risk is still there, and it can change very quickly. When more people are outside, there are more infection. The likelihood of anyone contracting or coming in contact with a case would be high, and that would definitely lead to a higher risk in the community. Right now, the risk has been stabilized, but we like to see it going down.
Any questions from CTV?
With the impending announcement tomorrow as we enter stage 1, I know marinas have been getting ready, golf courses have been getting ready. I know all those people are itching to get back to, to doing what they love to do. What are your concerns heading into this first phase?
I think the biggest concern is the perception, and I think that's what I am trying to address is people need to know what this means. It doesn't mean that the risk has gone down, the risk has decreased. The risk is still there. I think we are getting a better handle on how we are managing some of these cases and how people are, all these cases and contacts are being followed up. We are seeing a decline in the community spread, which is good. But when you have more people outside, the likelihood of community spread increases too. So I think it's just a matter of how do you balance some of those risks with the measures that we are recommending, versus the gradual reopening of people coming out from their homes and spending more times outdoor. If we can follow those guidance while still enjoy some of the outdoor activities, and as the economy opens up and people are visiting those stores, following the same guidance, maintaining physical distancing, going only when you need to. It's not a place that you should be just go for window shopping. So maybe spend some more time and give it a more thought that yes, we need to be outside, we need to be engaged, we need to be connected, but what are the best ways we can do that without putting ourselves at risk? So I think that's the direction that we want to remind that it's opening doesn't mean that the risk has gone away. No, it hasn't. It just means that you need to be extra careful because now you have more chances of coming in contact with other people, and making sure that you're really, really clear in your mind what precautions you need to take, and when you're interacting with others, what you need to do to protect yourself and also your family.
Just as a sidebar, 300 resolutions so far. Just wondering if any of those are from St. Clair College, if any of those cases have been resolved, and if so, because I've heard that they are stuck there pretty much until this pandemic's done because they can't return to their homes. Is that true or false?
So some conversation, by definition, we will consider them as resolved, but the challenge is the homes where they're coming from are the homes are currently in outbreak. And in order to limit the ability of the home to manage all those individuals in their facility, there has to be some consideration that how we can safely make that transfer. I'm aware some of the conversation are happening from the St. Clair College to maybe not going back to the home, but to the subacute hospital, the Hotel du Grace Healthcare. So some patients are being transferred there too. So there are some innovative ways that we are doing to as a system to provide that kind of level of support. But to answer your question, I think it really depends on the facility. And right now, we know that the facility is still under outbreak, and some of these conversations, when it happens, we'll have to take all of those factors into consideration before a transfer is happening.
Any
Questions from AM 800?
There's been a lot of talk lately about children at risk, and the province issued a statement this morning in reference to the Kawasaki syndrome and whether there's a link with COVID. What can you say about that, and how much at risk are our children?
So everyone is at risk for sure. I think there's the risk is them, and the biggest challenge when we are talking about children is their ability to self-isolate or to follow some of the guidance that many of the adults follow. And for them, if they are coming in contact with someone or a suspect person with COVID, the likelihood of them contracting the disease would be high. So from that risk, it is a high risk, but not anything different other than their behavior only. When it comes to Kawasaki-like disease, I think the risk is it's being studied at this point. We don't know for sure if it is linked with COVID. The biggest challenge, what we are some of the studies that we have seen is people when they are presenting with some of these unusual symptoms. So Kawasaki disease is a kind of a vasculitis. So it's an inflammatory reaction to the small vessels of the body, and the children under the age of 5 years are most likely impacted by it. And when that happens, and if the suspicion is with respect to what triggered it, there has been some viral etiology to it. So some viruses cause this type of triggering system, and then the concern is maybe COVID has triggered that. But when these children are swabbed for COVID or with using the nasopharyngeal swabs, it will come back as negative. So you don't have really a system to say whether they're actively infected. But then when antibody testing was done, it showed positive for COVID-19. So that means they contracted the disease earlier on, they cleared it, but their body is still reacting to some of those triggers and leading to this inflammation of the vessels that is causing the Kawasaki disease. So it is currently being studied right now. We don't have a lot of information, but when we get to the antibody testing and when we have the antibody testing available in our community, I think it would be really important for us to look at all the cases that we have, especially with some concerns of Kawasaki disease or any other type of vasculitic reaction that we are seeing in not only in the children but also in older adults.
Do we know what the youngest case is locally? There's 10 between the ages 0 and 19, but what's the youngest case? Do we know?
I don't have that number right in front of me. I apologize. We can share that at our Friday update.
Okay, thank you.
Any further questions from Windsor?
Yeah, the province announced this morning that Canadian Armed Forces personnel have been deployed to 5 long-term care homes across the province.
Is that in Windsor or Essex County by any chance?
None at the Windsor-Essex County Health Unit. We were in contact with our local regiment and had some preliminary conversation and some of the discussion around what would trigger us to request help from them. So they are there and we can reach out for their assistance as needed, but there is no one deployed, at least in our area, in any of the long-term care home.
Any further questions from Windsor Star?
Did the man in his 60s who passed away have underlying medical conditions?
Yes, I believe. I don't have that detail, but yeah, they have underlying medical condition that led to the death.
And the majority of people who have passed away have had underlying medical conditions. That's still the case?
That is still the case, yes.
Thank you.
Any further questions from CBC?
No, thank you.
Blackburn?
No, thank you.
CTV? AM 800?
I'm good, thanks.
Thank you, everyone.
Thank you.
Thank you.